Georgia Black Pages is marking a remarkable milestone. 35 years of distinctive publication, and you can be a part of this incredible journey. Show your support for Alex, Habersham, and the Black Pages by purchasing a congratulatory tribute. But wait, slots are limited. 35 years is a huge achievement, and now's your chance to get in on the celebration. Whether you're an individual or a business, don't miss this opportunity. Come celebrate, celebrate. Reserve your slot and help us make history. 35 years in 2026. Go to Mac and Middle Georgia BlackPages.com today. Don't wait, celebrate with us.
I usually don't do this because I do my show from the cuff or from the hip or whatever you want to call it. But because this conversation is so important, guess what I'm going to do, y'all? I'm going to read something to you. I'm going to read a definition because I want to help emphasize how important this is. A stroke, S-T-R-O-K-E, and obviously this is about medicine. A stroke is a medical emergency that occurs when blood flow to part of the brain is blocked or when a blood vessel in the brain bursts. Listen to me, quick treatment can save lives and reduce long-term disability. End of reading. But that's what we're going to talk about today. We're going to talk about strokes, a stroke, the strokes, and strokes. And the reason we thought it would not be robbery to talk about it is because, if in fact you can prevent something bad from happening to you, and if in fact information is the vehicle that can be utilized to prevent that catastrophe, then I feel a responsibility, along with my guest today, to impart that information to you. This is a call to action. I'm your host, Alex Habersham, and I have with me, two experts. Somebody who handles the stroke center, and then we got a doctor, who's going to help, who also treats it and going to help advise us. Both of them are going to do that, on what we can do and what the treatment is and what the signs are and what you got to stop doing and what you got to stop eating and why you need to stop smoking and don't drink too much, and pay attention to a lot of things. All of these factors that influence having a stroke. And I'm cheating a little bit because they wanted to say this, but I'm going to say it anyway. Particularly women. So we have Miss Denise Goins and Miss Dr. Naomi Kirkman-Bey with us today. And Denise, you go first and just say your position and your role as it relates to stroke.
So I am the stroke program coordinator here at Atrium Health Navicent. I've been here for 12 years. I've been involved in stroke for 18. Been a nurse much longer than that. And my role is to ensure that the patients that come in to Atrium Health Navicent receive the highest quality of care. And when I say that, we know that they do by coming to our facility, but I also ensure that the stroke order sets are in line with the American Heart Association clinical practice guidelines, because that is research-based information. So anytime a patient gets admitted to the hospital, the physicians follow those specific order sets to ensure that everything that needs to be done to work that patient up is completed. Because when that patient goes home, we want to make sure, number one, we figured out why they had a stroke, although we know about 25 to 30% of strokes are what we call cryptogenic strokes. We really can't find a specific cause. In that case, we look at risk factors, which Dr. Kirkman-Bey and I'll talk about in a little bit. But we want to make sure that all the appropriate tests are done and that patient understands how to recognize a stroke, another one if they have one when they go home, and that they're on the appropriate medication or any treatment protocols that they need to be on to prevent them from having another event.
Okay. Well, thank you so much for explaining to us what happens after the fact. But I'm going to kind of turn to Dr. Naomi Kirkman-Bey to talk about what happened before the fact and what can happen when the fact doesn't happen. I know that doesn't make a lot of sense, but y'all understand what I'm trying to say. And I think it needs to be emphasized that strokes are preventable. And then I mentioned in the definition that quick treatment is necessary. So Dr. Bey, Kirkman-Bey, just talk a little bit about what a stroke is, and then what are some of the factors and the behaviors that may contribute or enhance the possibility of one's having a stroke.
Well, I believe that the explanation and the reading that you did earlier, it was spot on because you basically define what a stroke is. You know, it's a lack of blood flow in a part of the brain and it produces symptoms. So when you look at a stroke, you start talking about having manifestations of number one, whether the person cannot speak, whether they are weak, whether their arm is weak, their leg is weak, whether they have generalized weakness. So they have symptoms that says that something is wrong. The most important thing is to identify those symptoms and say something is wrong and we need to be moved to action. We need to, get up, call the ambulance or have a family member call the ambulance and get the patient to the hospital as quick as possible, because when that happens, then we can start treatment immediately. As soon as they come in the door, we can make sure they get to the CT scan. We can make sure that if they having a stroke, we can give them the stroke medicine to break up the clot and to decrease any of the disabilities or death that may occur in
Yeah.
that patient.
And it's my understanding, I've heard that the quicker, you can get to that treatment, the better off you're going to end up being in the long run. I understand that really, in some instances, people have experienced phenomenal success,
Absolutely.
remarkable success by getting quick and early treatment.
Absolutely, absolutely. Soon as you feel like something is going on, you need to not wait, not see if it's going to disappear, not, say, I'm going to wait it out. You need to get up and, like you said, be called to action and immediately come to the hospital. Call the ambulance, get yourself to the hospital, because the quicker you get here, especially within a time factor, we can help you. The longer you wait, then that diminish our ability to really do what's necessary to decrease the disability that or the mortality that may occur.
Yeah, that's understand. Ms. Goins, I understand there's a little trick, for want of a better word, uh, that one can use the kind of, as it relates to what they need to do. They call it fast. I mean, what does that mean? I mean, and I want people to remember fast, because if in fact you're having one, or you see somebody, a family member, or what have you, uh, is having one, then there's a quick action that you can take, and there are signs that would indicate what you need to do. So, what does FAST mean?
Yes, sir. And actually, nowadays we're using Be Fast.
Right.
We're
Okay.
making it a little bit. We added another two letters onto that acronym, and we want patients to be fast, to act fast. And the B is for balance. So if patients have a sudden onset of dizziness or inability to walk or discoordination, and along with some other symptoms, and the E is for eyes, whether it's loss of vision or blurred vision. And then the F is for face. We ask patients to smile. And if you're home alone, you can even smile in a mirror to see if there's a facial droop on one side. The A is for arm or leg weakness of any kind. And the S is for speech. We ask them just to say some words or to say a sentence like, you can't teach an old dog new tricks. And is that speech slurred or is it inappropriate? Are they saying every word? And that T is not only for time, that T is for terrible headache. So if someone has keep in mind, all of these are sudden symptoms. So if they suddenly have the most excruciating headache and their terrible headache of their entire life, the T is for time, and time is to get to the emergency room. That golden hour that we talked about is up to 4.5 hours, but the sooner that patient gets there, the better the outcome possibly. We lose 2 million brain cells for every minute that our brain is not receiving blood supply. So think about that. Next time someone has symptoms, we need to make sure that they are be fast, and they act fast to get to the emergency room quickly.
So don't wait.
Yes, don't wait.
Don't wait. Wow, wow. So I know some people are gonna hate to hear this, Dr. Kirkman-Bey, but talk about some of the behaviors and some of the actions that contribute or enhance the possibility that one could possibly give you a stroke.
You know what? But before I address that, I want to say just some current statistics, especially when it comes to women and strokes. I want to add that in, and I'm going to add in some of the behaviors in terms of the high blood pressure, the diabetes, and all of those things. But when you look at the statistics, in fact, women have a disproportionately higher rate of strokes than men.
Wow.
And that's not necessarily spoke about, most of the time women do not understand that. The general population do not understand that, but the women have a higher propensity for strokes. And that is because we have high blood pressure, we have diabetes, we have heart disease, we have arrhythmias like atrial fibrillation, we have estrogen. And so when you go in menopause, that plays a role. When you're pregnant, especially in Black women, when you're pregnant, preeclampsia plays a role because women do have strokes when they're preeclamptic and eclamptic. So when you look at all of the disease process, we actually have a higher burden of strokes than men. And more importantly, we have more complications. So the more complication is the increased mortality and increased morbidity. We have to
Wow.
understand that when we have a stroke, we may live and have all of the complication. We may not be able to speak. We may not be able to move a part of our extremity. We may not be able to walk. And those complications may last a long period of time. So when you look at the statistics, 1 in 5 women in their lifetime will have a stroke. 1 in 5.
Wow.
That's pretty much so. And then women account for more than half of the strokes in the United States, more than half, because we have an increased preponderance of strokes. The other thing is that 57% of stroke death occur in women. So not only do we have the stroke, but we have the increased mortality of that 57%. And when you look at between men and women, 55,000 more women than men experience a stroke in a year. 55,000 more women than men experience a stroke in a year. And also, we have the worst functional outcome after strokes. Now, why is that? Because we tend to minimize stroke as women. Now, if we see these symptoms in our husbands, our brothers, our fathers, our sons, we tend to galvanize them, make sure they get to the hospital. But when we have these symptoms, we tend to say, this may be anxiety. I may just be stressed, which all of this plays a part in the stroke. I can wait. I may just be dehydrated, so let me lay down instead of moving to action, as you say, and coming to the hospital. But as if it's our husbands, our brothers, our fathers, our sons, we tend to get them to the hospital quicker than we get ourselves to the hospital.
Wow, that's absolutely amazing. And I think it's very revealing, really, because for some reason, and I think that this is generally true, when I think about a stroke, my mind automatically gravitates toward a male, I mean, just automatically, because I guess maybe I have seen, just not knowing more males who have had strokes, because of certain body changes or what have you. So it's so interesting, and I'm so glad you brought that point out that, women are very susceptible to having strokes, and hopefully, and then I'm going to ask Ms. Goins to go over that be fast again, because I don't think we can overemphasize that, and we're going to project it on the screen. So now let me ask you a question first, Dr. Kirkman-Bey. So you're saying that if a person gets the treatment within 4 hours, then they stand a reasonable chance of the effects of the stroke not being as bad as it could be. Is that what you were saying?
Absolutely. If we are able to treat them, I always say that the time frame is actually 4.5 hours. But if you are able to get to the hospital within 1 hour of the event, 2 hours of the event, 3 hours of the event, then we decrease the death of those brain cells that Denise was talking about. The 2 million brain cells is you diminish that. You want to save as many brain cells as you possibly can. So the faster that you get to the hospital, we're able to give you the medication. The in the street they call it the clot busting medication. We're able to give you that, and we also can send you to other places if you have what's called a clot in a large vessel in your brain, because we are able to detect that. And there's places that we have agreements with that can remove and retrieve those clots. We're doing some of that also. So
Wow.
that is very important. So it decreases your long-term disability. And that's important because on the long term, you don't want to be able to have, not be able to walk, have disabilities where you cannot speak, where somebody has to take care of you. That's the greatest fear of every woman, is somebody's taking care of her from that standpoint versus we taking care of ourselves, and taking care. We're home givers. We and taking care of other people.
Yeah, and I think the moral of that story is better to be safe than sorry. And I think that maybe, if you don't mind, you need to emphasize again the encouragement of those symptoms and the enumeration of those symptoms, either one of you, so people will know that, if like what you said about the headache or what have you, but whatever those signs are, I think it would not be robbery if we just kind of repeated them to kind of embed them in people's minds. So if they see any sign of either one of those things, then, and then whether it's that or not, but if it's potentially that, then I think that they need to take some action. So talk about those symptoms again, if you would.
So I'm gonna let Denise talk about the B fast, but I'm gonna say some of the things that we can take care of before B fast. High blood pressure is a propensity in our community. You Unfortunately, we have some non-compliance where we don't necessarily take our medication because it's a silent killer, so we don't feel it. We don't feel the blood pressure until it gets out of hand. And so but that's a big risk factor. Diabetes is a big risk factor. High cholesterol is a big factor. Stress is another. Arrhythmias, heart arrhythmias, palpitation, all of those are factors also. Having atrial fibrillation is a factor. So when you start looking at these factors that can increase our risk of having a stroke, we can decrease our risk of having a stroke by taking care of those things. Let's take care of our blood pressure. Let's take our medicine. Let's exercise. Let's not have a sedentary lifestyle. Let's change our diets. Let's do what's necessary so that we can be healthy. Let's take care of the diabetes. Let's, lose some weight, do whatever we can, exercise. All of those things is all the same thing. Get up out the chair, stop looking at the television, go and do a little exercise there. And so if we take care of our risk factors, we can diminish having a stroke. And that's important. So I'm going to turn it over to Denise so she can talk about BFAST again.
All right, thank you.
Right. And when we talk about be fast, one thing I do want to concentrate on is that these are sudden. These are sudden changes. And that B is for balance issues, loss of balance, inability to stand up, or being dizzy and not having coordination. The E is for eyes, and it could be eye issues like double vision or blurred vision, loss of vision in one or both eyes. That F is for face. You can look in the mirror and see, do you have a droop in your face? Is one side drooping or not? For a gentleman that has a big beard and the family's wondering how can we tell if he has a facial droop? Well, when he smiles and shows his teeth, if he has a facial droop, you're going to see fewer teeth on one side of the face than you will the other. The A is for arm or leg weakness. It could be one arm, it could be one arm and a leg, both arms, which would really be a bad situation. And then that S is for speech. Again, it could be slurred speech or loss of speech or inability to get out all the words, not being able to say a complete sentence. And then that T is for not only a terrible headache, but it's for time. And just remember that we need to get you here as quickly as possible. The sooner, the better.
Wow. This is a call to action. And we certainly have enumerated and expressed some actions that can't now. And then watch this. Knowledge is action too, because you're receiving that information. And last time I checked, there's some action involved in the consumption and the consumption and the digestion, if you please, of that information, along with those behaviors that we need to be careful of, and what how we should work with diabetes and high blood pressure and take our medication. And Dr. Kirkman-Bey said, "Get up out of the chair." And I don't know why she was looking at me when she said that, but I thought.
But I will say, from a public health challenge, is that it's estimated that 8% of strokes are preventable.
Wow.
From a public health stand, and that strokes remains the leading cause of disability among women.
Wow.
The leading cause of disability.
Wow.
We have almost 800,000 strokes a year. A stroke occurs every 40 seconds, and someone dies of a stroke every 3 minutes and 17 seconds.
Absolutely.
So it's really important, and then they said when it's a blood clot in the brain, and then we just need to be cognizant of that. And then I'm sure that not only are we helping some individuals, we're helping some families, because anytime you see this anywhere, we are our brother's keeper. So, and then watch this, since you are so informed, when you see some of these beef-ass actions, maybe you could just pull somebody's coattail, say, hey, why don't you go and get checked? Why don't you
like
make
right
sure,
now?
Right now, make sure that you're not having a stroke, because you don't want that to happen. Well, I'll give you all 30 seconds to make your pardon statement each.
Okay. Well, I'm going to let you go first on the 30
Thanks a lot.
seconds.
So it is important, just want to reiterate that twice as many women dies from stroke than dies from breast cancer. Dr. Kirkman-Bey had some terrific stats for you about women. But we want everyone to know that stroke isn't just an old person disease. We have younger and younger population coming in with stroke. And again, it has to do with the risk factors. And just because you're 20 years old doesn't mean that you can't be having a stroke. So we want not only the older generation, our senior citizens, to be aware, but we want our younger members of the community to also be aware. Anyone can have a stroke at any age.
Wow.
And so I just want to impart, especially in the African American community, that Black women have more strokes than white women, and we have it at a younger age. And that is because of, the smoking, the diabetes, the hypertension, the high cholesterol. And we need to look at that, and we need to understand that 80% of the strokes are preventable if we prevent them. And the way we prevent them is by taking care of ourselves. It's not just important to take care of our family members, our families, our husband and our children and our parents. It's important to take care of ourselves also. And it's very important to recognize that silent killers like high blood pressure, it can affect us. So we need to be forthright and aggressive about our lifestyle and being the best we can in terms of being healthy.
This is a call to action. I'm your host, Alex Habersham, having had this phenomenal and informative interview with Mrs. Denise Goins and Dr. Naomi Kirkman-Bey, all centered around detection, prevention, and not living with a stroke if we don't have to. So let's be very cognizant of this information, and let's be observant, not only for ourselves, but for anybody else that may have some of the symptoms that have been mentioned in this interview. I can't begin to thank you ladies enough for such valuable information. And I'm sure that we are impacting the community by sharing the kind of knowledge that will make a difference and keep somebody living a good and healthy life. Thank you again, and have a great day.
www.makingblackpages.com. Come on and celebrate, 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 celebrate. The Macon Middle Georgia Black Pages is marking a remarkable milestone. 35 years of distinctive publication, and you can be a part of this incredible journey. Show your support for Alex Habersham and the Black Pages by purchasing a congratulatory tribute. But wait, slots are limited. 35 years is a huge achievement, and now's your chance to get in on the celebration. Whether you're an individual or a business, don't miss this opportunity. Come celebrate, celebrate. Reserve your slot and help us make history. 35 years in 2026. Go to Macon Middle Georgia Blackpages.com today. Don't wait, celebrate with us.